Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Tumor Lysis syndrome causes and treatment. Tumor Lysis syndrome, TLS, occurs when a large amount of cancer cells die at once, either spontaneously or as the result of cancer treatment, and release their contents into the bloodstream. This can cause a potentially fatal imbalance in electrolytes like potassium, calcium, and phosphate, and dangerously high levels of waste products like uric acid in the blood. /R/N/R/N TLS can cause potentially devastating symptoms like irregular heartbeats, seizures, acute kidney failure, and coma. It most often occurs with blood cancers but can happen with certain solid tumor cancers as well. The treatment is primarily focused on reducing uric acid levels and normalizing electrolyte levels with medications and hydration. /R/N/R/N This article describes the causes and symptoms of tumor lysis syndrome, including who is most at risk. It also explains how TLS is treated and prevented. /R/N/R/N Tumor lysis syndrome occurs when a large number of cancer cells die suddenly. As tumor cells die, lyse, and break open, their spilled contents including potassium, phosphate, and uric acid are released in massive amounts into the bloodstream. /R/N/R/N This spillage ultimately leads to the following metabolic abnormalities. /R/N/R/N High levels of phosphate, in turn, bind to calcium to form calcium phosphate crystals, resulting in a severe drop in blood calcium levels, hypocalcemia. /R/N/R/N The massive death of tumor cells also triggers the release of inflammatory proteins called cytokines. This can lead to a wholebody inflammatory response known as a cytokine storm, which can cause multiorgan failure. /R/N/R/N Tumor lysis syndrome most often occurs with certain blood cancers and a small handful of solid tumor cancers as well. Tumors vulnerable to TLS are typically aggressive, fast-growing, and highly responsive to chemotherapy. /R/N/R/N The cancers most commonly associated with TLS are /R/N/R/N TLS is less commonly associated with /R/N/R/N Researchers have found that more than 1 in 4 children with acute lymphoblastic leukemia will develop TLS after undergoing cancer treatment. /R/N/R/N Tumor lysis syndrome typically occurs at the start of chemotherapy. It can happen within a few hours of treatment but is most often seen 48 to 72 hours after chemotherapy starts. /R/N/R/N TLS can also occur spontaneously, but this is rare. /R/N/R/N In addition to chemotherapy, risk factors for TLS include /R/N/R/N Electrolytes are electrically charged minerals that the body needs to function normally, regulating everything from heartbeats and muscle contractions to eye and brain function. Having too many or too few as a result of TLS can disrupt these functions and lead to symptoms like /R/N/R/N High uric acid levels can be particularly harmful, leading to a condition called metabolic acidosis that can quickly become fatal if left untreated. Symptoms include /R/N/R/N metabolic acidosis along with the deposits of calcium phosphate crystals in the kidneys can lead to acute kidney failure in which the kidneys stop working. Symptoms include /R/N/R/N Research has shown that acute kidney injury that develops from TLS is a strong predictor of death. /R/N/R/N Tumor lysis syndrome is suspected when a person undergoing chemotherapy for specific cancers like ALL, AML, or SCLC develops signs of kidney failure, metabolic acidosis, or heart rhythm problems. /R/N/R/N To aid in the diagnosis, providers often use the Cairo and Bishop classification system. This system classifies TLS based on laboratory findings and clinical features. /r/n/r/n Laboratory TLS means that 2 or more of the following metabolic abnormalities have occurred within 3 days before or 7 days after the start of chemotherapy, /r/n/r/n. These abnormalities occur despite adequate hydration and drugs used to reduce uric acid levels in the blood. /r/n/r/n Clinical TLS is diagnosed when the laboratory criteria from above are met with the addition of at least one of the following scenarios, /r/n/r/n. If a person is diagnosed with tumor lysis syndrome, they will be admitted to an intensive care unit, ICU, for treatment. The treatment will consist of some or all of the following therapies, /r/n/r/n. Hydration is essential to the normalization of electrolytes and the clearance of uric acid. Fluids are given intravenously, through a vein, to maintain a urine output greater than 100 ml per hour, milliliters/h. /r/n/r/n. A diuretic, water pill, called Lasix, furosemide, may be given to help increase urine output to reach and maintain this goal. /r/n/r/n. Electrolyte imbalances are monitored every 4 to 6 hours and corrected with the following measures. /r/n/r/n. Dialysis would be needed if acute kidney failure occurs. There are other indications for dialysis in cases of TLS, including /r/n/r/n in people undergoing cancer therapy. Several strategies may be implemented to prevent TLS from even occurring. These include, /r/n/r/n. Tumor lysis syndrome is a medical emergency that occurs when a massive amount of tumor cells are killed and spill their contents into the bloodstream following chemotherapy. This can lead to a dangerous imbalance of electrolytes like potassium, phosphate, and calcium and dangerously high levels of uric acid in the blood. /r/n/r/n TLS is most common with aggressive blood cancers and certain solid tumor cancers like small cell lung cancer. The emergency treatment of TLS involves intravenous hydration, the rapid reduction of uric acid in the blood, and dialysis if kidney failure occurs. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.